for coming today for this important announcement. I'm going to hand it over to County Executive Mark Elridge to start us off.
So this is another one of those press conferences that you don't want to have to do, but you have to do. This is important, and so I'll have a few words to say, and then I'm going to turn it over to some other folks. And I guess the first thing I want to say is, as you all know, the governor announced yesterday there are 3 travel-related cases of coronavirus here in the county. I found out early evening yesterday, and it's pretty safe to say I've been either on a phone or on text with people up till late last night and starting in the first thing this morning when I woke up. So this continues to be a fluid situation, and we get more information as the hours tick on. I want to emphasize, as the governor did, that there is no reason to panic, and life as you know it should continue pretty much as it was before this became news, with the caveats of what we're saying about precautions to take, and that's the important thing. We have to be extra careful about what we do in the course of things to make sure that the spread of this virus is contained. We've been preparing for this scenario since January, so we're not caught by surprise for this. I think everybody kind of knew intuitively that once it was in the United States, that sooner or later it would be popping up in different places. We knew that, Marylanders, like everybody else, travel around the world, have contact with people, and that it was entirely likely that the scenario would develop something like this. We're not surprised, and we were preparing. And, the truth is there's not a lot you can do because there's no cure. So the recommended, care for most people is stay home, take lots of fluids and deal with it, if it gets bad enough, then you wind up in a hospital. But basically, there's no medication, so there's not a lot we can do proactively. There's no, what's it called, a vaccine or anything at this point. So it's kind of monitor and take care of in a kind of normal fashion. We're working very closely with the Department of Health. I know the state is looking to make sure supplies are available, so I had a conversation this morning with Senator Zucker, who's provided contact information with the state so that if we need sanitizers and other things, we'll be able to get a hold of those materials. The Department of Health is working to get the travel histories of all the individuals, where they were, how they came back here, and what they've been doing since they've been back here. And they're going to follow up and monitor those individuals and also look at where they've had contacts in the community. Our commitment is to ensure the safety of all the county residents and all the people who come to the county to either visit or work. We are an important place. We bring a lot of people in and out of the county. We want everybody to know, whether you live here, whether you work here, or you're visiting here, that we're committed to everybody's safety. And I wanted people to know that the risk to the general public is still very low. The guidance that we're giving people is stay away from people who are sick. And if you're sick, stay home from work or school. Don't expose people, and if you know somebody's sick, take precautions against overexposing yourself. Do not travel if you're sick. Obviously, this complicates things because if you're traveling, you have the potential to have contact with a lot more people, and it becomes even more difficult to figure out who you had contact with the more you travel. So if you're sick, please do not travel. Wash your hands often with soap and hot water, and if you don't have another sanitizer available, use an alcohol-based sanitizer, which can also work. Cover your mouth and nose with tissue or your sleeve if you're coughing or sneezing. And those are just basically the precautions. So we're going to make sure you stay well informed. We will pass on information as soon as the information becomes public to us. We want people to know what we know, because the best way to ensure people's confidence in what we're doing is that the information that we have is put out to the public as quickly as we can make it possible. I want people to visit our website, montgomerycountymd.gov coronavirus, and to sign up for the public health and environmental alerts under Alert Montgomery, so we can make sure that we proactively can reach out to you. I understand that people are anxious. I've had calls from friends and also just from constituents who are texting and emailing me and asking what to do, and I'm giving the same advice to my friends and people who have emailed me as I'm suggesting today. What we know is what we know, and the precautions are pretty straightforward. We believe that life does not need to be radically altered, but we certainly have to have a higher level of awareness in what we're doing and what's going on around us. And so I would just say take reasonable precautions, be aware of your own health. Don't take chances in exposing yourself, and don't take chances if you get a cold in exposing others. And with that, I will turn it back to Barry, or turn it over to Mr. Katz. Thank you.
Thank you. Good morning. My name is Sidney Katz, and I'm the president of the Montgomery County Council. And my colleagues and I want all of you to know how pleased we are and how fortunate we are to have Dr. Travis Gales as their public health and public safety administrator. The public health and public safety teams have been working so diligently during this evolving public health issue, as well as their partners at the state and federal level. We are all working together. We are communicating, and we want to tell everyone how pleased we are that that is what is happening. We're certainly concerned. Our public health and safety providers have been consistently preparing and training for this type of situation at both the county and the state level. We have the utmost confidence in our testing protocols and mitigation strategies. In addition, the county's emergency management team has plans in place in the event that the virus impacts additional members of our community. We want to make it clear that this is not a crisis. Community members should not panic, but instead prepare as you would for any event that may keep you at home for 2 weeks. This means doing things like making sure all your medications are up to date, having non-perishable food items in the home, and making contingency plans in case you or a loved one needs to work from home. We ask all of our residents to stay informed and to contact your health care provider. If you have traveled internationally and have a fever, call for shortness of breath. Individuals can also contact 311 for assistance. And we all want to stress, and we're about to hear from literally our expert in Montgomery County, Dr. Travis Gales, but we want everyone to know that they have been working on this, they have thought this through, and they're going to keep our community safe. Thank you very much.
Good morning, everyone. Before we delve into specifics about the cases that have been mentioned and the governor announced last night, I'd like to speak to the folks at home watching on TV, because I feel like as part of the conversation that we've been having, we've been talking a lot about numbers, we've been talking a lot about viruses and all those kinds of things, but we haven't really created space to talk about and address the fears and anxiety that folks have. So I want to place this here and let folks at home know that we understand that, we take that in, we don't dismiss that, and we factor that into the decisions we make in terms of the next steps that we need to take. So we don't only just think about a clinical perspective or an epidemiologic perspective, we also think about the anxiety that it brings in terms of something that's new, that we've never seen before. We also recognize that there are a host of other fears and concerns as well related to how I access healthcare and who is a trusted source of information, particularly in this age where there are all sorts of information that can be gathered from social media, so on and so forth. So we want you to understand that we are working hard. The frontline staff who is executing a lot of the plans that we're discussing and talking about are dedicated, they're brilliant, they're experienced, and they're working hard to make sure that we deliver the information to you in a timely manner, making sure that it's accurate, it's comprehensive, and it addresses the concerns that you have. So as best as you can, to the 1.2 million residents of Montgomery County, I want you to feel that you can trust us and understand what we're providing you as transparent information to address your concerns, and trust the efforts of those who are on the front lines executing their jobs on a daily basis. Now, as has been mentioned, we train for this, we practice, we prepare for this, we have exercises, but there's never anything but the adrenaline that comes when you have the reality of it. And we recognize that adrenaline does also bring up a lot of questions and concerns. And I want to highlight the numerous resources that we have, including the county website, as well as the state website and the CDC website, that provide evidence-based, factual information to guide and address a lot of the potential concerns that you have. I know this is going to be tricky because, again, we're going to throw out a lot of different terms. So before we delve into that, I want to explain a couple of those to make sure you get an understanding of the different terminology. Now, the governor's office declared a state of emergency. What does that mean? Does it mean panic, and so on and so forth? And in actuality, we at our command center in the Public Health Emergency Preparedness Services team are moving to an active status. So what does that all mean? Does that mean, we're going to see an uptick in cases right away? So when we talk about declaration of emergency, those terms are most influential when helping activate staff. So making sure we have adequate staff to staff all of our centers on a 24/7 basis. So when you're calling in our call centers, making sure there's someone there who's trained and knowledgeable to be able to give you the right answer. We recognize that we have some work and are working on addressing the ability to make sure all of those capabilities are accessible by language, different languages, to address those concerns. So we're working on that and making sure that that is available and up and running fully. And so that has to do, when talking about emergency, that has to do with mobilizing staff, being able to mobilize funds to be able to pay for all of these different resources. So that's what that term is focused on. And when I talk about us moving to active status, it has to do with we're staffing up to be able to make sure that we are able to meet the needs of the community and address your concerns, and hopefully take a more proactive stance in terms of preventing potential cases, new cases in the future. So a couple of other terms I want to throw out is we're going to talk about incubation periods. So when you've heard it related to COVID-19, we're not talking about coronavirus anymore. We're talking about the specific name of the illness, COVID-19, because as some of you know, coronavirus refers to a whole family of different viruses, including the common cold. And so within that, there's a full spectrum of severity of illness within this family. So as it specifically relates to COVID-19, we have seen COVID-19 hit a lot of different countries, and the number of countries affected are increasing, and we're getting updates on a daily basis. And we've seen a number of cases pop up in the United States. When we've seen those cases, there are some differences within that, and I want to make sure that everybody understands. There's differences in terms of how they're transmitted. So, as the cases are here in Montgomery County, which I'll talk about in a few seconds, those 3 cases are travel related. They're related to individuals who travel to an area where they were exposed to COVID-19 and came home infected with the virus. That's different from community transmitted, which we have seen in the most recent cases in Washington and Northern California. Community transmission means that an individual who had no travel history or didn't have any significant risk based upon being exposed to someone else with a significant travel history got sick and got the illness in some way, shape, or form. And that's probably our most concerning level of transmission because we don't have an active source that we can point to that caused those cases. I want to be clear, as best as we know today, based upon the clinical data and the epidemiologic data that we have available, we don't have any cases of community transmission within our community. Everybody clear on that? As of today, as best as we know, we don't have any evidence of community transmitted cases of COVID-19. Now, we do have 3 new cases that are tied to travel-related exposures. The governor's press conference last night, Deputy Secretary Phillips laid out a lot of those criteria and those individual cases. I want you to know that the state has been working on doing contact tracing. And by contact tracing, I mean literally going through and checking contacts. So if I was exposed on a certain date, tracking all of the different places that I've been, all of the different venues I have accessed, and trying to get a sense of any individuals who I've come into contact with during during that time period before I may have quarantined myself or isolated myself. And so the state has been actively working on that since they heard about these cases, and we have joined in that effort, helping assist them in terms of helping complete that investigation. There is no set timeline within which that will be completed, other than to say it is being done expeditiously. And as part of that, other contacts may be deemed high risk and require testing and follow-up, and there is the potential that we may see other cases tied to these index cases within our jurisdiction. But what I want to also emphasize that Deputy Secretary Phillips mentioned is that all of these cases are doing well clinically. They're all doing well clinically. Everybody get that? They're all doing well clinically, okay? And so that suggests that the severity of the illness, that even if it's here, remains in a mild to moderate category. And for some of you who may have been at our briefing on Tuesday, we know some of the information has changed because the world is rapidly changing around us as it relates to COVID-19. We talked about how there's some populations who are predisposed to having more adverse outcomes than others. We recognize that individuals who have a host of chronic conditions or acute health conditions that may predispose them to poorer health status, our elderly population, and individuals who have concerns about their immune systems may be more susceptible to developing a more severe form of the illness. But again, I want to repeat what I said a couple of phrases ago. The 3 cases involved here are doing well clinically, and for the most part have their symptoms have abated. They are all under isolation. They are not being exposed to the community right now. And again, emphasizing the state, as well as in partnership with the local health department, are completing the necessary contact investigation to find out if there are others who are at risk of exposure. So those are the cases that were mentioned last night. We have been in close communication with the state and talking back and forth and gaining more information. At this time, based upon the total and some of the information we have available, including clinical data, epidemiologic data, as well as any other anecdotal data that's relevant to the situation, we are not recommending any large-scale closure of any of our government buildings, facilities, including schools. What we are recommending to folks, as has been pointed out by the county executive and Council President Katz, is to continue to do the precautions that we have listed before. Washing your hands thoroughly, washing surfaces. If you are symptomatic, staying home from school or staying home from work. One other thing that came up in a meeting this morning that I want to highlight, and I'm very thankful that was part of the discussion, is this notion of travel. So travel itineraries are being updated on a daily basis. We see countries added to the list from the federal perspective in terms who's level 4, level 3, level 2, level 1. What that means is the government has determined that based upon the information they have, the number of cases and the level of disease in those particular areas, those places are being designated high risk, low risk, medium risk. And those advisories are what are used to advise you, should you be going to any of those destinations, such as in several weeks over the spring break period. So while there are very limited and few travel bans to certain places, be mindful of that. And it would be a good idea to look into those travel warnings for international places, but also be mindful on a domestic level as well. There is no current guidance, and we haven't put out any guidance from a jurisdiction perspective. We're thinking about that and looking into that in terms of saying you shouldn't go to this place or that place. But it would be mindful and important to start thinking through that as you make your travel plans or think about that over the next several weeks. So stay tuned for those types of announcements. So no large global recommendations beyond that. Again, all of this is subject to change. And the last thing that I would ask for the public at home, in addition to trusting us and hopefully taking our sense of calm and hopefully addressing some of your anxious energy, is to be patient in some situations. Again, our task is to get information out as quickly as possible, but our task is also to make sure that information is accurate, it is comprehensive, it is thoughtful, it is disseminated in a way that is easily understandable, and that doesn't always happen right away. And so I hope, as best as I can convey, the information that we are putting out has gone through that process, has been vetted, and we have made sure it's accurate, it's factual, and it's potentially addressing the concerns that you have. So I think that's a summary of the cases and a summary of where we are in terms of investigating those cases, as well as larger options and actions that we'll take. Again, just to remind you that we are nimble and flexible as best as we can, and those recommendations are subject to change dependent upon the information that we gather from the investigations. Thank you.
Good morning. My name is Dr. Earl Stoddard. I am the county's Director of Emergency Management and Homeland Security. I want to thank Dr. Gales for a wonderful overview of the current situation. I do want to highlight a few things that the county is actually doing actively to prepare for and respond to this particular event. And I should start from a little bit of history. We've been preparing for potential public health emergencies for a very, very long time in Montgomery County. We have a very dedicated public health emergency preparedness and response team within our Department of Health and Human Services. We also have a very robust emergency management team and emergency management group. And when I say emergency management group, that is actually defined as the entirety of our collaborating and supporting partners, both within county government and external partners like our hospitals, our nonprofits, and others. As it relates to this COVID-19 issue, we began coordinating with the health department and our colleagues in our emergency management group in January. We were early on in this, and we recognized that it could be a potential issue, so we started sending credible, factual information to our partners so that they understood. Beginning last week, we recognized that there was a clear escalation in what was happening both internationally and within the United States. And so we began a series of actions that were targeted towards increased collaboration and cooperation between our emergency management group partners and our local Department of Health and Human Services. Starting last Friday, we began the series of weekly calls that included partners like our school system and others to make sure that everyone was ready for two sides of this response. First, we have our Health and Human Services response that's coordinated state, federally, and locally to focus on the public concerns and responding to potential cases like we've seen happen yesterday. The other side of it is we need to make sure that we have a continuity of our operations and continuity of our government to make sure that the essential services that we provide to our residents can stay in place as unfettered as possible. Our goal has largely been to focus on making sure that we can set up situations and keep our facilities safe, our employees safe, and make sure that we're ready to both support the health department's response, but also keep our businesses, our facilities open and operating in absolutely the same fashion that people should expect them to be. So that's been a large focus of what we've done in the last week. I want to highlight, we began coordinating both with the State Emergency Management Office as well as our colleagues in the National Capital Region several weeks ago. We've had ongoing series of calls. Even yesterday, we had a call with our emergency management colleagues from across the state to coordinate this before we knew that we had these cases coming down last night. And so that is a very robust system, and it's a system that has been built over years of trial and error, and we expect that it will operate successfully for this event. We believe that Montgomery County is ready for this new challenge. We aren't glad to be facing it by any stretch, and we know the concerns that are out there within our public, but we believe we have a robust system of partners who are very committed to providing services to our residents, and they will succeed in providing services even during these trying times. Thank you.
Questions? Yes, we'll take some questions.
Dr. Gales, if I could just throw three, because they're all related as regards to these incidents that are occurring now. Do you have testing capability as you begin to do the testing capability you need as you begin to do the investigation? How many contacts have you been in touch with so far, and how large a universe might these contacts be? And are there any other self-quarantines or other things related to these cases at this time?
Sure. So the first question in terms of testing capability, that has been something that lots of departments have been asking, not only for those jurisdictions with positive cases, but also from a general perspective. As you can recall, on Tuesday, the decision was made to allow for states and more local jurisdictions to be able to test. So in terms of testing, there's two concepts. There's collecting of the specimen, and then there's where the tests are actually analyzed. So we are able on a local jurisdiction to be able to collect specimen, but the tests are sent to the state lab in Baltimore where they are analyzed. One of the advantages of having more local testing and not having to send them all to CDC, and let me just actually take a second to explain that. So an individual who is concerning for having coronavirus receives a test, the necessary sample is collected, specimen is collected, it is sent to the state lab. The state lab does a first level of analysis. That analysis comes back positive. The individual is considered a presumptive positive based upon that test result. It is then sent to CDC for confirmatory tests, but we're treating presumptive positives as positives. The old system, they were just sent through Baltimore and sent directly to CDC without any analysis in-house. So as you can imagine, being able to do it on a local level cuts down on the window between when a person comes in for that initial test and when they can get the results. So we don't do test analysis on the local level. We don't have that capability. But again, the tests are collected locally and sent to the state lab where that analysis is done there. So as part of, and this bleeds into your second question, the state has coordinated the follow-up in terms of taking the lead for the contact investigations. And so as a part of that process, they're able to determine if an individual needs to be tested. And so the specimen will be collected either by their staff or we would be directed to do that on a local level, and it would be sent to Baltimore. Now, in terms of the scope of that, I can tell you that the investigation is ongoing, and they have a pretty good sense of the map and scope of the contacts, but I won't comment on that further since the state is taking the lead on that, other than to say that they've been very quick, they've been very thorough, and we hope to have some more concrete information to either be shared informally or formally over the next 48 hours.
Any other self-quarantines based on the investigation of that universe of people? Are there any other quarantines occurring because of that?
I think there are a number of folks that are being looked at from a contact perspective, but I don't have the information to confirm whether or not they are in that status. I know that they're looking at everyone carefully who's come into contact to determine their level of risk.
Thank you.
Dr. Gales, Aisha County, Fox 5. I know we've been confirmed that the 3 people from Montgomery County were on the same international cruise, but did that, if you can answer this, did that cruise come to the Port of Baltimore, or did these patients actually fly back to the area after the cruise? And if they did fly back, I'm not sure if you can tell us which airport they flew into, and can you tell us what countries they may have?
Sure, I'll tell you as much as I can share with you. And again, let me preface that by saying, and this gets to the question for the folks at home and this concern about transparency. So I want folks to understand, if there's a question where I may not answer fully to the level, it's not trying to hide any information from you all as the general public. We also have the balance of trying to protect the privacy of the individuals who are impacted and affected by this. And so there are instances where there may seem, he left some details out. What's he trying to hide? We're not hiding anything, because every individual who's a part of the investigative process, who's doing the contact investigation, has access to all of that information that's needed to do that level of work. To your question, I can say that the cruise was not affiliated with Baltimore. At this point, since there seems to be some things public, these individuals were not on a cruise associated with Baltimore.
Any information on the whereabouts of the county, maybe up county, down, east?
No, we're not sharing that information. Again, part of this is we have to protect the privacy of the individuals, but utilize as much of the information as possible, which we're doing to drive our response. And regardless of where they would be located geographically, the recommendations that we would recommend to folks regardless of the area, would be the same.
Dr. Gales, can you tell us what facility they went to and if not, can you tell us why you're not revealing that?
Again, it's privacy issues, and so I won't reveal the facility. I can say that the staff that were involved in treating the two individuals who are a married couple did take necessary precautions per protocol to protect themselves and to protect others who may have been in the emergency room setting during that time period.
What date did the three folks actually first seek treatment, and was that because of symptoms or something else? And did they go to a hospital more than once?
So the individuals, again, they were separate. So two individuals and one individual, and they were not traveling together. I think this is consistent with what Secretary Phillips mentioned last night. They sought medical care at different points. They did experience symptoms upon returning and sought necessary medical treatment at that time. I think one of the questions, and I will maybe anticipate a question coming from someone, this may address that concern, is the question is, well, if they came back, let's say in February, why were they not tested then? Well, if you can recall, as I mentioned earlier, the testing guidelines did not change until this week. And so even within the testing guidelines that were put out by CDC, they talked about symptoms in addition to a travel history. And there were certain places associated with those travel histories. At that time they returned, the travel history was relevant to China. And if you didn't fit that criteria, you weren't getting tested per the guidelines. We know that has evolved over the last week, and several other countries have been added. Iran, South Korea, Italy, and China remains on the list. And that speaks to a question that we will have to be very candid about in terms of really getting an assessment in terms of who really is considered at risk, because you may have traveled to a country and come into contact with someone from one of those other countries, or you may have traveled to a country that isn't necessarily on the list right now. So we have to be more mindful of that and more thoughtful in terms of doing a deeper dive in terms of the histories when we're talking to patients and asking additional questions to be able to assess whether or not someone is truly at risk.
Dr. Quick follow-up. So from the time that they returned home to the time they were quarantined, did the three individuals go about regular activity? And could you give a sense of what their schedules were like? Where do they go to supermarkets? Do they go to church?
So I'm not privy to all the specificity of that. I can comment to say that there was some level of normal activity. In one instance, I think there was a recognition that they were all not feeling well, so activities were limited in terms of not going to work and things like that. So again,
Either the couple, was this the couple or the individual?
In both cases, And again, I have some information related to what they found so far in the contact investigation. And what I can say is so far is that we're looking into specific instances where they may have had contact with others. But as best as I can surmise from that summary, there was very limited interaction with school-age children in terms of that as a potential concern, obviously for kids in the school system.
And were they going to work? Sorry, can you mention?
No.
How long will they be in isolation and when will they be cleared?
So it will depend on their individual clinical situations. I'd be hesitant to comment further without knowing their specific clinical data. But what I can say, again, definitively, and the Secretary emphasized this last night, is that they have all responded well clinically. And this is important given we have talked about how if you are older, you may be at risk. And so in both instances of the couple and the other individual, they have convalesced well and are, for the most part, I won't say entirely, but for the most part, asymptomatic and doing well clinically.
Doctor, as a local and state official, do you have any thoughts for the CDC, for instance, about expanding the testing protocols at this time? Do you think that they might already expand those? As a local official who has to deal with this on the ground.
Well, I think those of us in public health recognize the value of utilizing testing to get a full sense of the entire scope of a particular condition. As we're finding out and has been discussed by others here today and has been talked about on the news, is we don't necessarily have a fully accurate picture of what the true incidence is, considering the testing was limited from a travel perspective. So those of us on a local level do applaud being able to, one, have increased capabilities and access to tests and getting results in a timelier fashion, as well as welcome the opportunity to expand and explore how we can tinker with the algorithm to make sure that we're not missing any other cases that could potentially not be tied to those specific travel histories.
When you talk about the specimen collecting, are you saying like it's just a regular strep throat kind of thing, or is this a major specimen collecting?
So it involves potentially expressing sputum and nasopharyngeal swabs. And when collecting those, it's best to do those in controlled environments, so with negative pressure rooms, because as you can imagine, if a person is positive for the condition and it's respiratory spread and you're expressing that into the air, it could potentially get in ventilation. So it's important to make sure that the tests are collected in proper environment. So to the question of being able to test locally, it's not just a question of everybody can go through and get a test. It's making sure that the right precautions are put into place when the specimen is collected to protect the individual and protect other people.
Dr. Gales, Chris Gordon, NBC4. You said that these individuals had limited interaction, and then could you clarify, did they have interaction with school-age children? And do you have their whereabouts in terms of if they went to supermarkets, have those places been contacted, disinfected, and that kind of thing?
So, to reiterate, the state is leading that process, and they have those specific details. I don't have all of the ins and outs of their itinerary since they returned. My perspective is giving more global updates in terms of kind of summarizing what has been shared with our team. But as best in terms of summary, there was nothing to jump out in terms of suggesting extended or more than minimal at all contact with school-age children.
Dr. Gales, can you say anything else about the CDC team on the ground here? How many people are here? What sort of work are they doing? And is it sort of a roving team that does this kind of work?
So the CDC has a robust cohort of public health professionals that are staffed anytime there's an outbreak. They have their day jobs, and then if there's an outbreak of a situation, they're dispatched through the medical corps and the public health corps. So we have a concentration of those just by virtue of where we're located, our proximity to NIH and a host of other government entities. So we have a cohort of those here naturally. We don't have any deployed within our local health department at the moment. There are some working at the state level, and that's something that could potentially see an increase in as the days move forward as we find out more information.
What is being done to protect the homeless people in Montgomery County?
So we have identified a couple of groups that we consider to be highly vulnerable. In addition to those, based upon the physiologic conditions that I laid out in terms of age, immune status, those kind of things. But two other areas where we're prioritizing are our nursing homes and long-term care facilities, because as you see in the state of Washington, there's a cluster outbreak there associated with a long-term care facility, again, based upon the medical condition of most of the residents there. But then the other group are folks who are our homeless population. So we're working very closely as a part of Department of Health and Human Services. We have the Services to End and Prevent Homelessness who work on these issues every day, but we are working with them to provide training for their staff as well as information to shelters and community organizations so that they, one, are aware of the resources on a county level they're aware of the opportunities for us to be able to step in and assist them, but also providing some of the basic information to their clients to understand what their risks may be, recognizing that they may not be sitting at a TV looking at the press conference or getting an email update. So we've been working on that over the last week to make sure that information is readily available to those organizations. And the Services to End and Prevent Homelessness leadership team has been crafting a continuity of operations plan specifically for their internal group, but also for the external vendors and partners we have in that space.
I commend this county executive for letting you speak.
Dr. Gales, one question. So from what I understand, three people arrived February 20th, correct? And then they were tested earlier this week on Wednesday. So if anyone else is looking at this, it's quite a gap. I mean, I guess what was the process to have that many days in between before we even knew?
Yeah, so it goes back to the testing guidelines, and again, we're coming in, and getting information secondhand. So I cannot comment on the initial conversations that happened from a federal and state level. So I just want to make sure everybody's clear on that. But I would like to commend the healthcare providers who have been a part of each set of circumstances because they followed the guidelines that they have. So there was not, I want to make sure folks understand there wasn't any negligence or dereliction of duty on their part. They followed the CDC guidelines at that point in determining who was considered to be high risk based upon their particular histories. And so based upon those criteria, they were screened appropriately during that time period. When it was deemed that they could have potentially been in an area where there were cases that popped up, the CDC notified the state and notified these individuals that they were at risk and needed to be followed up. And once that communication happened, they were tested appropriately, and here we are today.
Last question.
The three individuals, do we know at this point whether between the time they arrived home and the time that they were quarantined, did they travel to the District of Virginia?
As best as I can tell, I don't believe so, but I do. That's something that, again, I will defer to the state in terms of those details. What I can share with you is that the state, in conducting that information, contacts and talks to other jurisdictions. We've been in contact with the health officers across the state of Maryland, as well as the health officers in the Capital Region, D.C., and Northern Virginia. They have been great partners, and as Dr. Stoddard mentioned, we have been working together as a region and as a state for the last month. So we're in constant communication, but the level of, as best as I know, no. But again, I would defer to the state, who has more exhaustive information as a part of that investigation process.
All right. Thank you. Thank you, everybody. And I just want to reiterate again, please go to the county website for those folks at home for additional information. I want to thank the media for being out. Our folks will be available for you to talk to. I want to say one last thing. The council, the county executive's office, and all the agencies within the county are working diligently together to make sure that we provide enough information and that we keep everyone safe here in Montgomery County. Thank you very much. We'll keep you apprised of when that will be as we get information.
You did a good job.